Hello there, everybody. My name is Anshante, and I am from the Elijah Network, South Dade One Voice Community Coalition. And today we are being joined by Adriana. How are you doing today, Adriana?
I'm good, thank you very much. So yes, I'm Adriana, and I am the public health nurse at Elijah Network, working with the PhD project.
And can you explain what the PhD project is?
The PhD project stands for Prevention, Health, and Diversion. It was established to reduce the use and abuse of opioids, meth, prescription medications, and over-the-counter medications, which goes in hand with combating the opioids crisis. For those of you who don't know what an opioid is, it's a painkiller, like Oxy, Percocet, this type of medications that make you drowsy and makes people high.
And for those who may not know, what is the opioid crisis?
For those who don't know, the opioid crisis, or actually the opioid epidemic, it actually refers to the use and abuse of these painkillers, also known as Oxys, Percocets, heroin. It is designed to take care of the pain, but one of the side effects is that it makes people high, it reduces respirations, it lowers the blood pressure. So if they are taking an excess, or if you're not following the instructions, it can cause death. And as a matter of fact, about 130 people are dying of this type of overdose daily.
Wow, that is a lot of deaths every day.
It is a serious national problem.
Okay. And so with the PhD combating the opioid crisis, what efforts are being taken to achieve this goal?
We have taken several strategies. One of them is to reach out to the prescribers. There are also the doctors. Those are the primary care physicians who prescribe medications. So when we say prescribers, we are referring to the doctors. The doctors can go to the CDC site where they can find the latest and most accurate information about prescription medications of opioids. In the past, probably these medications were prescribed more freely, more amount, more often. And now there are different guidelines that the CDC has provided, and we want to encourage the prescribers or the doctors to just go ahead and study these new modules. They are for free and they are found at the CDC website. Also, there are different organizations that are providing free training for the doctors, so they can have the most accurate and up-to-date information for their patients. Another strategy that we are using and working on is to increase the awareness of naloxone. Naloxone is a medication that reverses the opioid effects. So if the person is not able to breathe due to an opioid overdose, Narcan counteracts the effects of the opioids. But this medication only works on opioids. It doesn't work on any other type of medication, and the street provides a lot of street drugs are not opioids, but the majority of them are. So this is one of our strategies. You can find this medication over the counter. It's also called Narcan. In the past, you could only find these medications in hospitals, but now they are over the counter, meaning you don't need a prescription. This medication is actually in the hospital. It can be used on the vein, IV. But now, obviously, for the community, it comes through, it's a spray that goes in the nose. So anybody can use it with minimum training. But when we are increasing the awareness of this medication, we also provide the way and how to use it properly. Another strategy that we are working on is educating the community of these opioids so they can have the awareness of what an opioid is. We are also providing education about the prescription and medication. So if you are a patient and maybe the doctor is giving you too many opioid prescriptions, it is already more than a week or 3-day use, maybe it's something that it can raise a concern. These opioids, these painkillers, can be found at the doctor's offices, and these are the medications that people are going to their homes with without fully understanding the side effects and risks of using the medications. So if somebody in the community has to use these medications, we want them to understand fully the way that they need to be taken, and also the strategies that they need to use once they are done taking these medications, and if they have any leftover, where to dispose of them. We want to also teach the community about the possible side effects of over-the-counter medications and the meth use and abuse. Finally, we are reaching out to the elderly communities and veterinarian offices because pets also take medications. They go through surgeries, some of them have illnesses, and they need these medications. So we need to educate the pet owners so they know how to take care of their pets and also the family around them. Studies have shown that many people abuse pain medications that were prescribed for the pets. We want to raise awareness in the community that once your pet is done taking the medications, these medications need to be disposed of properly.
So what are some activities that are being conducted under this project? You've been mentioning dispose of properly numerous times. How can a person properly dispose of medications?
The Elijah Network was able to sponsor pharmacies in the community with a medication drop box. So we have 5 pharmacies who have joined efforts to combat the opioid crisis in West Perrine and Homestead. And we have installed a total of 5 drop boxes inside the pharmacies. So the community can freely go to these locations and dispose of their medications right where they belong, in these drop boxes. They don't belong in the trash, they don't belong in the toilet, they don't belong in the cabinet if you are not taking them. We want to prevent overdoses, we want to prevent people taking their medications that they're not supposed to be taking, and 5 pharmacies have joined us. So I want to go ahead and share the names of the pharmacies, and for an exact location, please visit us on our website and you can see all the addresses. So the first pharmacy is Royal Palm Drug My Pharmacy, which is located in North Crum Avenue and Campbell Drive. The second one is Care Pharmacy and Compounding, which is located on 8th Street in Homestead. Naranja Discount on South Dixie Highway and 271. And New Life Pharmacy on South Dixie Highway and 220th. Advanced Pharmacy Solution located on 184th Street. That one is in West Perrine. So please come to our website and make sure that you know where these drop boxes are located. And once again, they are free of charge.
And so yes, when you go on our website, which is www.ovccsd.org, if you click on the RX Drugs tab, you will see the list of all locations as she stated, as well as their phone number. And there's also a quick video where Adriana demonstrates how to properly use the drop boxes. If you're unaware of how to use it, you can go ahead and check out that video to see. And it also tells you what you can dispose and what you can't dispose, because yes, you can dispose of medications and ointment patches and things like that, but things like needles and inhalers and anything like that can't be disposed of. So please make sure you double check what can be disposed and what can't be disposed in these boxes.
Absolutely. Besides the drop boxes, we have also conducted different activities. We have joined the Drug Enforcement Administration, also known as DEA. They are a national organization in charge of regulating the drugs industry. They have 2 national take-back days throughout the year. One is held in April and the other one in October. We had the honor to be part of it the last April. We partnered it up with the Homestead Police Department and the National Guard, also with a small nursing school. And we were able to make a difference by removing 33 pounds of medications from off the street. So they were collected and they were already incinerated in the DEA incinerators. We have received a lot of support from different organizations like this one. You can see all the data that has been collected at the DEA website as well. At the same time, we are going to participate in the DEA Take Back Day that is scheduled to be held this Saturday on October 26th. We are going to be in 2 of the pharmacy locations that are working with us. We're going to be in West Perrine, an advanced pharmacy solution, and we are also going to be in Naranja Discount Pharmacy. This time we're going to be with the police department of Miami-Dade County and also the National Guard. We also had a mobile take back day in August, and it was a success. The National Guard joined us at the same time with the Miami-Dade Police Department. We were able to raise awareness of the locations of our boxes. This event was held right before Hurricane Dorian. So as you can imagine, there was a lot of commotion, people outside in the street, and we had the opportunity to provide information about the locations of the drop boxes. We have a social media and community outreach, and Enchanté, you know a lot more about it.
So we do a lot of social media campaigns where we continuously inform the community of where the locations of the drop boxes are, as well as the importance of properly disposing medications through the drop boxes. And we also do a lot of community outreach where we go out into the community, tell them where the drop boxes are, tell them the importance of it, and how them disposing of the medications in these drop boxes really does make a difference in helping out the community as well as combating the opioid epidemic.
And there are many things that as a community we can do to aid combating the opioid crisis. Be vigilant, be aware of what you have in your cabinet. When it's your turn to dispose of your medications, please do it properly. You can come to any of these locations to dispose of them. Remember, it is free of charge. You don't have to pay a cent. Nothing to just get rid of them. Please come to our boxes. Follow us on social media so you know about our activities, and if we have anything planned, we will be providing the most current updates. And participate, get involved, be part of the solution. You can protect your family, you can protect your pets, you can protect the elderly and your entire community, but just by being involved.
So I want to say thank you so much to Adriana for coming out and talking to us, educating us about the opioid epidemic, as well as the importance of being vigilant, disposing medications when they're no longer used.
Thank you, and remember, come join us on October 26th.
Yes.
We will be there with the National Guard and the police officers. If you would like to come, please email us or call us so we know you will be attending. If you want to be part of it by educating others. And if you just want to come and dispose of your medications properly, you are also welcome to do so.
Yes, so follow us on all social media so you can get all the updates. And visit our website, www.ovccsd.org, for more information. So thank you so much, Adriana, and have a good day, everybody.
Thank you. Bye.
Bye.